As the editor-in-chief of Clinical and Experimental Obstetrics and Gynecology, I always had a big interest in advancing the field of medicine and obstetrics and gynecology, which I had specialized in. I think the drive was just really to generate an understanding, because it's really only through research we can understand what we do. And at the same time, it's only through research that we can change what we do. So, to innovate and um, to advance the field, research is just so important. And it's because of that that I decided to have a career in research. I chose reproductive endocrinology and infertility for several reasons. Um, I think obstetrics and gynecology is such a cool field. It's just a wonderful field where you get to take care of patients where at least one of the patients is going to outlive you, right? And that was one of the things I found hard about medicine, was that I found a lot of internal medicine to be sort of life support, where you were taking care of people the last couple of years of their life, and I found it a little depressing. But obstetrics and gynecology, if you have an issue, it's an urgent issue. You deal with it quickly, usually. And most of the time, the outcome is very happy. And I thought that was wonderful. And then reproductive endocrinology itself is a field of obstetrics and gynecology which advances incredibly rapidly and is so dependent on technology and changes so quickly. I found that part of it to be so fascinating. And really, that was what I found interesting in terms of uh, pursuing a career in reproductive endocrinology and infertility. And also at the
Okay.
same time in REI, it's also an understanding of the glandular mechanisms, which goes so in depth. It's more than just superficial. And as such, I enjoyed that part of it as well. Now, those are great questions. For sure, AI is going to change our lives very substantially in the next 5 to 10 years,
Hmm.
both in and out of medicine, without a question. Um, you look at the level of change. I think, China's an example, the level of change in AI. A year ago, at the celebration for the Lunar New Year, um, China brought out robots, and the robots were stumbling around. And this
Hmm.
year, they brought out robots for the celebration of the Lunar New Year, just 1 year different. And the robots could, do martial arts and dance in ways that they couldn't just a year prior. It just shows the changes, how they went from being uncoordinated to extremely coordinated in 1 year. So, how is AI going to affect medicine and research? And some of the challenges are really interesting. Um, I think that people are terrified of AI because they don't want to admit some of the changes AI is going to bring to medicine. And for certain, there's the possibility of certain areas of medicine even disappearing or getting very minimized in terms of the human component. I think anything that is pattern recognition, like radiology, AI will do wonderful job doing, and we certainly will not need the number of radiologists we have today. On the other hand, in other areas of medicine, I think it's going to ease the workflow for people. And what does that mean? It means, for example, in dermatology, where diagnosis is pattern recognition, the AI is going to do a great job of picking up more lesions that need biopsies. And the dermatologists themselves are going to spend more time doing biopsies and doing surgery. So we won't need less dermatologists. They're actually going to have more work to do. Now, in terms of research, AI put there's several huge changes that are going to come, and at the same time, challenges. Uh, Without a doubt, AI um, could be used to write research articles, and that
Hmm.
is a challenge for journals because it's not supposed to be that the AI is doing the research. It should be the human beings are doing the research, and there's the possibility there of fabricating research articles. And I think that it's a real challenge. Right now, it's not so hard to pick up, but eventually it will get very difficult to pick up. On the other hand, AI can be used to finesse a research article. And I think that's fine, particularly if it's disclosed. What does that mean? You write an article, you do the research, you write an article, and then you could possibly use the AI to improve the grammar and the language. And as long as you disclose that at the end of the article, say that AI was used to improve the grammar of this article, that's fine. It's a tool that'll be helpful, and I think most editors feel that that's fine. It hasn't written the article; it has improved the article for you. You wrote the article; you used your terms. We don't all have the same English language skills, and I think that um, English is not necessarily a first language for some people, and
Mhm.
nevertheless, scientific research is published in English, and AI will be a way to help with this. Again, it's a multifaceted question. In terms of the reviewers, it's such an important part of a journal to be a reviewer because you are really determining the articles that are going to get published, and putting effort into it is often thankless, and we do thank our reviewers greatly. But I think that um, it's so important. And we didn't bring this up in our AI discussion, but one of the challenges today is, are people really reviewing, or is AI doing the review? And it's so important people review, because right now AI fabricates things. So if the review's done by AI, it's not going to be a quality review. It's going to have things that are in error, and we really don't want that to come out in the publications. So, it's a huge effort, and we so thank and appreciate our reviewers. It's really an important job that they do for us. That's the first thing. In terms of why you should submit to us, again, we are making strides to improve our journal, and I can't think of a journal that has raised its impact factor of this magnitude over the last 6 years. I don't think there is one. And because of that, it's really, a reason to get on board. I think you're going to find yourself publishing in a much higher impact journal than you anticipated when you submitted. I have a friend who's an editor in chief of a different journal. When I told him what we had done with our impact factor, he was blown away. He just couldn't even understand how we were doing it. And I think that, it's really, really a good time to be part of CEOG.